Good morning, everybody. How are you? Good. Well, it's a great privilege to be kicking off this morning's opening plenary with a distinguished panel from our Agency for Healthcare Administration. I think probably everybody in this room has interacted with AHCA at one point or another. And it was my great privilege to work there for about 20 years and to work with this team that is here today. So without further ado, I will introduce our speakers and then invite them up to begin the conversation. So we are privileged to have Secretary Shevaun Harris with us today. She was appointed by Governor Ron DeSantis to serve as the Secretary of the Agency for Healthcare Administration starting this February. Previously, however, she worked at the agency from 2005 to 2021, and was privileged during that time to be able to work closely with her. And she's a tremendous worker, a tremendous thought leader, and one of the smartest people I know. She focused on administration at the Florida Medicaid program, really focusing in the policy area and implementation, both quality improvement efforts as well as strengthening the policy foundation for the Medicaid program. This serves millions of people in Florida, as you know, well over 4 million people. She was also the lead negotiator for the multi-billion-dollar statewide Medicaid managed care contracts in the previous round of procurement. But then, prior to returning to the agency this year, she served as the Secretary of the Department of Children and Families for more than 4 years. And through implementation of key initiatives that promote resiliency and prevention, Florida experienced a decrease in opioid and suicide deaths, increases in adoption, improvements in child welfare prevention efforts, resulting in fewer youth in foster care and increases in adoptions, and also expanded service options for those contending with substance use disorders and mental health conditions. Secretary Harris is a champion for children and families, and her leadership is marked by a belief in accountability-driven systems, innovation, and continuous quality improvement, and AHCA is lucky to have her. But a leader is only as good as the other people who serve with them, and we are also privileged today to have with us Kim Smoak, who is the Deputy Secretary for Health Quality Assurance, which focuses on licensure and certification of all of our healthcare facilities, as well as our healthcare transparency initiatives in the state. And then last but not least, we have Brian Meyer, Deputy Secretary for Medicaid, who oversees all of the Medicaid program and CHIP programs in Florida. So without further ado, I would like to welcome you all to the stage. Well, thank you all for being here today. I know you have a busy schedule of speaking at events as well as administering these huge programs, and it's really a privilege to have you here today. We had agreed that we'd give Secretary Harris a chance to just give some opening remarks about your vision for the agency since you've been back, and let folks know kind of what's on the agenda coming up, and then we'll dig into some questions.
Is this on? Okay, great. Good morning, everyone. I know it's really early. I'm not a morning person, so I know some of you are probably, if you're like me, you're still waking up. So I'm not going to bore you too much, because I think there are lots of great questions that will be forthcoming, and we're really excited to dive a little deeper there into what's going on at the Agency for Healthcare Administration. I want to thank Beth and the team at the State of Reform for inviting us to be a part of this conference. I'm really excited to be back at the agency. As you heard, I served there for over 15 years ago, and my really entry into state government started there. So much of my identity as a public servant is wrapped up in my experience at the agency, and loved every minute of serving as Secretary of the Department of Children and Families, but a lot of my roots and my passion are in healthcare, and so I think it's a really exciting time to be back. Not to mention the fact that our mission touches so many individuals. We're all consumers of healthcare in one form or fashion. And I think our mission really speaks to the heart of what we all want when we go into a facility, or if you are on Medicaid, really wanting to ensure that you can receive the best possible care. And so we have really been, since I've been back, really setting the course for moving forward in terms of how can we be better. My hope is that the experiences that I gained being at DCF, working with some of the state's most vulnerable populations, will help inform our next steps, marrying that up with my experience when I was at the agency to kind of turbocharge our efforts to make things better. From a regulatory perspective, I think the expectation is really clear. We want to be fair, timely, and transparent, but also make sure that we're constantly looking at how we can streamline regulations without sacrificing quality. So I've tasked Kim with what are some of the things that we can give up in terms of regulatory activities that help us be more efficient and also don't sacrifice quality again. And so she's been hard at work looking at those opportunities, and I think the agency is always looking for those opportunities, but really for me, I think that when I think about where we can move forward, if we're not really seeing any major issues with a provider, are there opportunities for us to visit less, as an example? So looking forward to some of what will come out of that. From a Medicaid perspective, we want to focus on recipients are getting access to timely care and that our providers are getting paid in a timely manner. From a quality perspective, we really need to double down on our efforts there, whether it's well child visits, prenatal care, or chronic disease management. I think that there's a lot of room for improvement, and I look forward to talking a little bit more about that. And then even in the behavioral health space, which is near and dear to my heart, we should really be looking at the role that we play in the state. We pay a lot of money, and probably are one of the biggest payers of behavioral health services in the state under Medicaid. And so what are we doing to be a leader in the space to close the continuum, to make sure that we have a robust continuum, but also close gaps where they exist. And you know, one of the things that we continually want to work on is gaps in care for children as it relates to behavioral health services. I also want to make sure that we're just on the forefront of addressing longstanding challenges, really working alongside our biggest partners. So really enjoying getting to re-engage with our health plans and hopefully really driving quality forward alongside them. Also with our providers, I've had the opportunity to meet with many of them, some of the associations, but I'm looking forward this summer to getting on the road and really having some in-depth conversations about where you all see we can be helpful, where the pain points are, so that we can lead from the front in trying to address them. I know provider enrollment is still a big issue and a big concern, and it is sad to say that that's still an issue 4 years later, but we're going to put processes in place, and I know Brian will be talking a little bit more about that later, for continuing to address those issues. And I use that one as just an example, right, of where we need to be listening and working alongside each of you to try to find strategies and solutions to fix them. I know workforce continues to be a huge challenge in the healthcare space. We're no stranger to that. When I started, we had a 21% vacancy rate, which is crippling for an agency our size. And so we are hyper-focused on trying to address that. We're also trying to make sure we're maximizing the tools and resources that have been given to us by the legislature to play a key role in addressing workforce challenges through programs like our graduate medical education, slots for docs, or training, education, and clinical health program, or TEACH, where we're helping to support. And through some of those efforts, we've distributed over $66 million across 53 participating hospitals, and continue to try to do what we can to support getting the level of practitioner that we need in our state, particularly in underserved areas, so that we can maximize outcomes. Last but not least, from a technology perspective, we want to continue to grow and expand and do better there. I think we'll talk a little bit more about FX in a minute, but I'm really excited about the future. I know that that project has had a lot of bumps along the way, but there are also some other exciting things happening at the agency from a transparency perspective, using tools that we already exist, but then also really maximizing what's on the horizon in terms of our FX initiative. And I look forward to being able to share more of that with you. I shouldn't make this promise because I don't know if I can actually deliver on it, but I want to put it out there so that you know how serious we are. Like, I believe that we can land this FX plane, right, Brian? Before I leave, which hopefully in the next couple years. I know it's been going on forever. And so one of my top 3 projects is landing the FX plane. So y'all hold me accountable to that. Ask me about it every time you see me. How's FX going? Anyway, I know there's a lot more in store, so thank you, Beth, for this opportunity to just give you a high-level overview of where we hope to be going over the next few months.
Well, thank you, Secretary Harris. It's great to get kind of the big picture lay of the land. And I heard some laughter around FX. That's the Florida Healthcare Connections project, which is to revamp the Florida Medicaid Management Information System infrastructure, which is a huge undertaking. So more to come on that as we talk. So thank you for that. Well, I wanted to kick off and talk a little bit about statewide Medicaid managed care. So the agency has recently completed reprocurement and implementation of the new contracts, which are the heart of how the Medicaid program is administered. So you're calling it 3.0, I understand, the SMMC 3.0. And so in 3.0, you already touched on quality. What are the things that you're looking for in the next 6 years of these contracts to improve on quality, and how can folks in the room be part of that?
Yeah, thank you for that question. So when I look at the data, I feel like, coming out of COVID, and I know it's been 4 years, maybe longer, it seems like our quality scores have really been stagnant. We certainly had a dip, right? And we haven't really rebounded to the extent that I think we should. And so we really want to have critical conversations with our health plans, with our partners, on how we can advance in this particular conversation. And so part of that strategy is not boiling the ocean. As you know from your time at the agency, we have a number of performance measures, a number of areas that you can focus on in quality. I think we have over 30 performance measures that we hold plans accountable for in the quality realm. But we don't want them going here, there, and everywhere. So we're really trying to be, again, hyper-focused. What are the top 10 things that we want you to really, really invest in that are going to pay off dividends by miles? And so we have locked in on 8 key performance measures. The new contracts really have a carrot-stick approach, which I think in the past it's been more stick. Right? If you don't hit targets, you get liquidated damages. Whereas now we're really focusing on, if you do really, really well, there's an upside for the health plans. And so I'm really excited about just new tools that we're using and just a renewed focus on the core population within the Medicaid program, why it was created, and how we can improve in health outcomes for those core constituencies, like our children, our pregnant women, and again, our most vulnerable from a chronic disease management. So I think honing in there, being more laser focused there, and then most importantly, working alongside the health plan. So we had our kickoff Quality Forward meeting a couple days ago, really exciting conversations with them. I think the health plans are really excited about moving the needle forward too. And I think most importantly is that we want to do so in partnership.
Great. You mentioned, this one's for Brian. Secretary Harris, you mentioned the additional carrots that are part of it. So I know there's a quality withhold, and that's part of that. That's maybe not a carrot, but maybe talk a little bit more about that, how that works.
It can
because
be.
I've actually heard already this morning at this early hour from a provider about that and how they're trying to think about implementing that. So it's definitely having a ripple effect already. Can you explain a little bit more about that initiative?
Certainly. So in the previous iterations of our SMMC program, statewide Medicaid managed care program, really we would have performance measures and through the negotiation process, through the procurement process, individual targets. Each plan would negotiate individual targets for the agency. And there would be a financial penalty, liquidated damages assessed really for failing to meet those negotiated targets. And we've changed our approach with this new iteration to really try to incentivize plans to go beyond just what the negotiated target might be. So that's where this quality withhold comes in. It's the first time that we've implemented a quality withhold. It's about 2% of managed care plans premium. It's about it being withheld and then will be redistributed to the managed care plans based on how they score on a point system on these 8 primary performance measures that Secretary Harris mentioned that we're focusing on. Plans that do well will have the ability to earn more than their withhold that was taken back, and then plans that don't do so well can earn potentially 0 or only a portion of their withhold. So we're hopeful that by that approach and giving an increased carrot to go beyond, perhaps, and to continuously improve performance, that'll help drive increased program performance, as well as the higher performing plans. Another new concept in this contract is the ability to earn preferential enrollments through the auto assignment algorithm process for those higher performing plans as well. So we really tried to bundle our approach to quality to really continuously have a carrot out there, to use that carrot acronym to continuously drive improvement. So we're hopeful that this iteration of the SMMC program will really result in the highest quality of our Medicaid program to date.
That's something all of you can be involved in and need to be involved in. So I hope you're taking notes on the key measures here that are going to be the focus for the next several years. We also talked a little bit when we were preparing about quality customer service and thinking about kind of serving the beneficiary as well as the providers. Is there something you want to talk about with the, different initiatives to improve customer service to the people that AHCA serves?
Yeah, so I think the new contracts definitely have requirements in them, more stringent ones around care coordination. I think, I was listening to something yesterday, and the group that was talking was just talking about how important care coordination is, particularly for your dually served, those with more complex needs. And so I think being able to have more stringent standards, more ratios around that, particularly for more vulnerable populations, will certainly help people navigate services more readily and more easily. And so we are excited about that. I don't know, Brian, if you have anything else.
Certainly, and I think as part of the FX program, we're really trying to bring a new approach to customer service on the recipient side. So right now, there's lots of places a member has to go, either through the website or choice counseling or the Medicaid helpline if they want to get help, also interacting with the plans and their customer service department. So what we're trying to do is when FX and that plane lands, we're going to have this concept of a unified operations center, which is really just a no wrong door approach and really a one-way in, both for the provider and the recipient member. So I think that will help hopefully try to make the delivery of healthcare more understandable for the member. I mean, it's difficult navigating the healthcare landscape, and certainly a big government program is not easy to navigate also from the recipient perspective. So we're certainly focused on doing what we can throughout this contract, whether it's through the FX technology side of it or any other type of contractual requirements and interactions with our plans, to really make it easy for the consumer to navigate the process.
I'll just add to that. I know we have kicked off some conversations with DCF, since they're responsible for Medicaid eligibility and they have their own customer service arm, how we can integrate better, right? So when they're receiving a phone call, if it's something in our space, obviously there are transfers that happen now, or at least making sure recipients or members know where to call, but there could probably be more of a streamlined and seamless way to move forward in that arena. And so we have kicked off some conversations there, and hopefully we'll be able to leverage both of our technological systems to move the needle forward there too.
That would be a first, I think. I felt like for years DCF was sort of a separate entity, and that was as much our fault at AHCA as DCF, just two really busy agencies doing what they do on a day-to-day basis and not necessarily having time to think about how to integrate. So that's great. One of the things that is probably the single most important thing to beneficiaries is to be able to get an appointment when they need it. And so I know this is a little bit sensitive because you have an active procurement, but could you talk a little bit about the network adequacy monitoring contract that you have out to bid?
Yeah, Brian, you want to take that one?
Sure, yeah. So also new with this contract implementation is really an approach to, as Secretary Harris mentioned in their opening remarks, is ensuring access for members. And over the past several iterations of our contracts, we've had seemingly robust provider network standards, and monitoring ratio requirements, monitoring time and distance requirements is one thing, and you can monitor and measure compliance with your standards that you have in the contract. But it's really, we found that it's really those kind of secret shopper activities where you really kind of get into understanding whether a member can really get an appointment, they can get it within certain time frames. So what we're doing with this new contract is we're in the process of procuring a new contract for an external vendor to kind of come in and really do a lot of robust network oversight activities. Again, don't want to delve too much into it because it's an open procurement at the moment, but certainly the expectation is robust network testing, robust provider network directories, making sure they're updated. That can serve to be a barrier if it's an outdated provider network directory, if you can't get in touch with a provider. Also, though, lots of boots on the ground, to use that phrase, for secret shopper activities, much more so than the agency would have capacity to do on its own. So we're hopeful that this will, once this contract is set up, will really help shed the light on what the access situation really truly is in the Medicaid program here in Florida, and will really help serve to increase access for members.
Can I just add, though, that we don't see there, or I don't see that as a punitive thing. I really feel like it's an opportunity to shed a little bit more clarity. I think as a leader, we all know that you can't have eyes and ears everywhere, right? And I know that when I speak with the health plan leadership, they're all in and committed to doing excellent work and having robust networks. But maybe boots on the ground, the experience may not be exactly as designed. And so I see this as an information sharing opportunity where we get information, but maybe it'll be helpful for them as well. And then it might uncover more systemic issues. Maybe it's isolated with a particular physician group or provider group, but either way, I think it can foster some good conversations around how we tackle this particular issue around access.
Great. That sounds like an excellent information gathering. I know it was always revealing when you would call and pose as someone trying to get an appointment, only to be told, months out or just no. Right. All right. I just want to kind of closing out the statewide Medicaid managed care. There's always expanded benefits that are negotiated. Are there particular ones from this round that you're excited about, or that you think will make the biggest difference in kind of moving the needle on quality or the patient experience?
I'll start, and then I'll see if Brian has anything to add. So there are two in particular. One's a group of expanded benefits, and then one in particular that I think will help address a longstanding issue for children with more complex needs. So it's no secret that the agency has been in a long-standing battle with the Department of Justice around nursing access for children with more complex needs, and really excited about the opportunity, the expanded benefit that the health plans are offering for children in nursing homes to transition out. We know that one of the issues is for families may be the home modifications that are needed to be able to have their child come back back home. And so I know many of the plans are offering upwards of $75,000 to support home modifications, which historically you wouldn't have been able to get anywhere near that amount. And even if you could, it would have been through a home and community-based waiver. So this is really, to me, innovative and really leveraging all the tools and resources needed through the health plans as a force multiplier for addressing that for kids who are not on home and community-based waivers. So really excited about that. Also, I think, again, using plans as a force multiplier, we all know that if you're struggling financially or having issues, it's hard to focus on your health, and so many of the plans are offering great expanded benefits in the way of vocational training or housing vouchers and things like that, that I think are going to be really, really helpful for members in need, and supplementing the resources that are already out there in helping to help their members be able to truly focus exclusively on their health and not be distracted by some of these other issues. So excited about that.
Right, so maybe not a specific benefit or whatnot, but really our approach to making sure that the benefits that are being offered to our members are utilized. So within the contracts this time around is really the agency will be measuring utilization, and any benefits perhaps that are lower utilization benefits, the agency will be asking plans to replace those with potentially higher utilizing benefits. And then if there's any benefits that are continuously low or underutilized, the plans may lose their opportunity to market that through outreach materials. So we are trying to take an enhanced focus on expanded benefit usage.
So it sounds like overall a theme of trying to make the promise of Medicaid and managed care real for the people that it serves.
Yeah, I think that the benefit of managed care is we can do so much more than fee for service, and so I think it's challenging ourselves to think big. And really, the health plans have been great in wanting to, again, walk alongside the agency, thinking beyond just health care, but other non-health care related items that matter, right? So it's been great.
Well, I would talk about Medicaid all day, but AHCA is way more than Medicaid, and so I wanted to talk a little bit about some of the areas around health quality assurance division. HQA is known for licensing and regulating facilities. Some of you may have had a visit at some point from Kim and her team, and I'm sure that they were tremendously professional and helpful, as they always are. But the other thing that you all do that maybe some people don't know as much about is healthcare information and transparency. And what are the kind of key, maybe just kind of a quick overview of what AHCA does in that area, and what kind of key initiatives you have going on in data transparency?
That. Thanks, Secretary Harris. And thanks, Beth, for allowing us to be here today. So, yeah, one of the things that Secretary Harris mentioned when she was talking about one of her areas that she's challenged us with in the Division of Health Quality Assurance is behavioral health. And in the transparency world that we have 3 transparency websites, and she has asked us to make sure that we enhance our Florida Health Finder with more resources in the realm of behavioral health. But Florida Health Finder is one of the 3. So Florida Health Finder is a website that you can go to, and it's our most visited website internally and externally, by the way. And those of us like myself visit it as well. You can find out information about all the 50,000 plus healthcare facilities that we license and regulate in the state. So you get information about facility specific information, services that a hospital may provide in their emergency room or other healthcare services. You can link to our inspection reports, any legal actions regarding this regarding the specific healthcare facility. As far as hospitals, you can link to their infection prevention and control rates as well. So that's our first website, and that's one of the things that we're working on now is taking that charge from Secretary Harris and saying, what can we do more for behavioral health? So we're looking at that. We have some information out there, but not where we need to be in this great state here in Florida. Our other website is Florida Price Finder. And Florida Price Finder has morphed over the years. We used to have only about 280 care bundles in the Florida Price Finder. So Florida Price Finder is that you can go to this website and you can get information about a specific procedure you may be having, where it's like a knee replacement. It's one of the top 3 or 4 most searched care bundles. And you get information about like knee replacement, and you can find this information specifically about knee replacement from before your surgery, during your surgery, and after your surgery, things that you need to do to have a successful surgery, but also that price is to see where you can find the best price. And that's what we want to do is be more transparency, be more transparent as there. So I mentioned we started with about 280. We're up to almost 400 care bundles on our website, so that continues to grow and grow, and again, more transparency. Our third website is our Florida, My Florida RX. And My Florida RX has all of our prescription, all of our medications out on our website, and you can go to our website and find the best price and best value in your area, whether you're in a rural area or a more urban area, and you can find those best prices. And we've had about 300 medications on that website, and we have just now moved to having about 400. So we continue to grow all 3 of these websites. One of the other things from a transparency perspective that Beth hit on is our HIE, our Health Information Exchange, and that continues to grow as well. We're in the middle of finalizing that procurement as well. And the other very benefit of Health Information Exchange is our event notification system. And our event notification system, a lot of our managed care plans are required to utilize our event notification system. And so we have a large group of our hospitals, about 99% of our hospitals also are engaged in event notification. So it provides that information back and forth so that the managed care organizations know when one of their members has gone to an ED, and just that exchange of information. So we continue to expand that event notification system. We work with our sister agency, Department of Health, regarding this as well, to gather that information again. So increasing that transparency between our healthcare providers. I think that's it.
That's great. If you haven't used these websites, particularly Health Finder, I think all of us will have a loved one in a healthcare facility at one point, and I have averted loved ones going to one-star facilities by just doing a quick check, and it's really an incredible resource if you yourself as a healthcare consumer, so can definitely vouch for that. We've already touched on workforce a little bit, and so others may not know that you have a role in some of the workforce development. Folks, we had Senator Colleen Burton as our keynote last year to talk about Live Healthy. So what is AHCA's role in the Live Healthy pieces of that large legislation?
Yeah, so a couple different areas. Obviously, I mentioned earlier graduate medical education, slots for docs, helping to support training of physicians, particularly in underserved areas. So we got a lot of funding, more funding to expand our reach there. We have the TEACH program, which again is helping to do much of the same in terms of individual getting training in more underserved areas, which I think is helpful. We all know that in more rural areas, a lot of the talent there leaves to go get their education in larger parts, larger areas, more metropolitan areas, and then they don't return. And so creating more opportunities for clinical training in more underserved areas, I think will be helpful. We're also really excited about the role that the agency plays, and we do it jointly with DCF, but around the behavioral health teaching hospital designation. So one of the areas where our workforce is a tremendous challenge is in behavioral health, particularly when it comes to psychiatric care or just even getting licensed clinical therapist. And so we're really excited about what the behavioral health teaching hospitals will bring forward in terms of a training ground to better prepare clinicians for working in that setting. And so I know we're really close to finalizing the designations of the 4 that were named in statute, and then are also reviewing applications from entities who are interested in getting that designation beyond the 4 named in statute. So really excited about that.
Great. There's so much to cover, and I feel like the clock is ticking down on us. So I'm gonna go faster on some of these. But Kim, we get the workforce trained. You got to make sure that they're safe and that they're the right people for the job. you are over the background screening system, which has grown and grown over the years. What's going on with background screening these days?
Yeah, so it's our care provider clearinghouse, and it's been in operation. It's one of its kind, actually, in the nation. It's really expanded and started in 2012 and just continues to expand. It started with our 7 state agencies, our Health and Human Services agencies, DCF, Department of Health, DOEA, as well as the Agency for Persons with Disabilities. And we moved actually just this year, April the 9th, we rolled in Department of Education. And just continues to grow and expand. Again, one of its kind in its nation. And as of actually last week, we had screened over 8,000 of our Department of Education employees in our background screening system. And as we move into the future, we continue to enhance the care provider clearinghouse, to continue to roll in addition to just rolling in other agencies, but also continue to roll in various practitioners. Later this year, we're rolling in additional healthcare practitioners from Department of Education. So again, it's one of its kind. We've streamlined background screening so that individuals that work in our healthcare facilities don't have to have multiple screenings. So it's kind of like a one-stop shop, and it's really a streamline to reduce those duplications. In addition to screening for our healthcare providers, we also do screening for, on the Medicaid side as well, and a Medicaid managed care plan. So it just continues to grow, and that work for, and that's as continue to expand as we move into the future. You'll be hearing more and more about ways that we're taking that beyond what it is today.
Can I just add, I know we're short on time, but I must say the the agency does a lot of things, I think, to promote quality health care, but background screening and the role that we play there is one of the most important things that I think that we can do from an individual, the person that is at your bedside, making sure that they are of good character and will not hurt you. As the secretary, one of the things that I'm responsible for is looking at the exemptions. I did it at DCF. I delegated to Kim at AHCA. But you see the things that come through, and it's your responsibility to, make judgment calls on that when they have a background, a felony or a misdemeanor, to really look at whether they have rehabilitated themselves. So I just wanted to chime in and say that that's a very, very, very important role, and we take it very serious. I know the lion's share of individuals go through without a hitch. There are no issues, but for that small percentage that don't, the role that the agencies play in looking at those is extremely important, and making sure that your loved ones get the best care by individuals, by nurses and techs and that kind of stuff.
And there's so many important functions. It's hard to even pick this sample, but I do, Kim, want to talk on emergency preparedness. So we are days away from hurricane season. Does anyone else feel like it just ended? Like just ended a second ago? Okay, so here we are, hurricane season. You have a whole panel on this, so don't give away all your secret sauce. But if you wanted to just say a couple things about being prepared with healthcare facilities, with the not just hurricanes, but other kinds of disasters as well.
Sure. So it is beyond hurricanes. I know everybody does a countdown waiting for June 1st, right? But, it's like Mother Nature doesn't know that it's June 1st and November the 30th during hurricane season. So it is, as always, about being prepared. And our healthcare facilities in the state, they have both federal and state requirements for comprehensive emergency management plans. And those requirements are for our all hazards approach. Not just, you're the hurricane state, Florida, so just looking at that, but an all hazards approach. And that's what we expect, whether you're a hospital, other residential provider, or a home health agency, or a nurse registry, or a homemaker companion. You are still required to have emergency preparedness requirements in place because you are meeting the needs of our healthcare recipients out in the state. So we do expect folks to be prepared. And I think that we always think about environmental, disasters, just weather disasters, hurricanes, floods, lightning strikes. But another big disaster that we have to continue to think about is cyber attacks. And cyber attacks have been on the rise in our healthcare facilities. Our hospitals, we know several of our hospitals in this state have had cyber attacks. in addition to some of our larger nursing home companies. So that is something that we continue to see on the rise, and we have been very out front with that in our agency, and our staff have really been doing sort of, I guess, scans of some of our websites in our healthcare facilities, and doing a grade like you got in school, A to F. And we are reaching out to those. My team is then reaching out to those facilities that have received a negative score to talk to them. And we're not doing anything secret. Our penetrating facilities' websites, we're just looking externally at their websites and saying, hey, you have some risk here. So it is very important that people pay attention to cyber attacks. In addition to our weather events can be very damaging as well, but so can, there was a study out there from a Medicare beneficiary perspective of just the deaths that even the cyber events have caused because of lack of services. So I didn't want to steal all the thunder since we're talking about that later, but I just wanted to touch on some of the other events from my emergency preparedness and response perspective.
That's great. Thank you. We promised we'd get to FX. So again, Florida Healthcare Connections, the overhaul, multi-year overhaul of the massive set of systems that run Medicaid, but also go beyond. So maybe you could talk just a little bit about that transformation journey and where you see it going from here.
Yeah, so I'll kick it off, and then I'll turn it over to Brian to give a little bit more key information on upcoming dates. But coming in and looking at the history and some of the concerns with the project, I've really been talking to stakeholders and really diving in with the team at what some of the impediments are, where we maybe get in our own way. And so we are really just taking a brand new look at every angle, down to how many meetings we have on a particular topic. I mean, it's been pretty, we've been diving deep. And our focus is let perfection not be the enemy of good, right? Like, have we established 50 standards and 40 of them get there where we really need to be, but we're just holding out and still having the plane up in the air, waiting on the 10, right? And so just reevaluating and recalibrating what it means to have the project go live. Also just trying to make sure that we are being more nimble, more agile with our vendors so that we can land the FX plane. So a lot of my involvement has just been, how do we move this along? How do we communicate better? How do we reduce the redundancies and roadblocks to get to the finish line? But more importantly, how do we leverage? I'm really excited about the provider services module and what's to come, as well as the Unified Operations Center in terms of the engagement with recipients and how we make that member experience better. But before we can realize all those gains, we have to get out of our own way. And so that has really been the focal point. So I think some of the trains that seem like they had gotten a little bit off of the track, we're getting them back on track, and we're excited that our provider module will launch in January. Right, it's January, right? And we're looking to see if we can fast track the recipient module, which I think had been slated for much later in 2026. Hoping to be able to escalate that and get that implemented sooner. And so I'll turn it over to Brian to just talk through some of the key milestones that we want you to be aware of, particularly when it comes to the enrollment piece, because that impacts a lot of you, your systems, et cetera.
Yeah, and if you can kind of focus for the audience on what is the impact to them? Like, what will they see on their side? Because a lot of that is behind the scenes for AHCA, but what will the impact to the providers and the public be?
Yeah, so, excuse me, a lot of the FX program to date has been behind the scenes, as you mentioned, Beth, whether it's the ISIP platform, whether it's the enterprise data warehouse that's been operational. So we're about to embark on probably the first phases of this that really impact external stakeholders and have a significant impact. So as Secretary Harris mentioned, we are planning to implement our new provider services module in January. With that comes actions and that our provider community needs to engage in, even starting as early as this fall, September, October-ish. how providers log into the MMIS is going to change. So all providers will need to go ahead and kind of re-register and get new login credentials. They're going to be going to a different location in order to do that. And when they will log in, even before the provider services module comes live in January, as is scheduled, anything between the interim, they'll be going to that new location. So we are about to embark on a significant outreach campaign to make sure all the providers are aware of this. For the health plans here, providers and associations that are here, we're happy to speak to your members and your groups to really provide in-depth conversations on this as to what it means to them. But we're about in the next 6 months or so, over the course of the next 6 months, we'll really be embarking on the phase of the FX project that really is starting to significantly impact members. And then once the provider services module is implemented come January, we're very hopeful that this will result in reduced provider enrollment application processing time. You know, this module that's been implemented in other states successfully has seen processing times reduced by as much as 50%. So we know that provider enrollment is certainly, it's not the easiest to navigate and certainly can take time. So we're hopeful that this really improves the customer experience on the provider side. But before we can get there, there are operational changes that we will have to continue work through with our provider community. So that there will be more forthcoming on that. But again, please reach out to myself or Secretary Harris or the team here if you want additional information. We're happy to speak to associations. We're happy to, we'll be on a big outreach campaign, so we're happy to really share whatever details are necessary to help really push this messaging out. And we would be more than happy to partner with anyone just to really help push this messaging out, to really make a smooth transition. I think Florida Medicaid has upwards of 250,000 providers. That's a significant population to kind of get and to move into a new operational system.
Great. Well, it is a massive thing, but I think, as you've said, now moving out into the public realm. So, great. Well, I think we have time for one more question. Secretary Harris, I'm going to put you on the spot. So you are one of the few people who's been secretary of more than one agency and more than one major agency, very large agencies. What would you like to say about the experience of the perspective that you've gained coming back to AHCA, having been at DCF? I know when I left and sort of got a different perspective from the other side, it really opened my eyes. But anything that you would want to share about kind of your perspective from that experience?
Yeah, I think when I got to DCF and really got my feet under me and really saw the impact that Medicaid has on, again, some of these, some of the populations that overlap, I often said, man, I wish I knew then what I know now. And so I feel like it's a huge opportunity to take a lot of those lessons learned and bring them back to the agency and share that experience, share that knowledge with the team doing the work. I think that being at the agency, you are a little bit more removed from the people. Right? Our job is to make sure our claims are getting paid and our providers are getting paid. It's certainly to make sure recipients are getting services, but outside of someone calling, you're not engaging as one-on-one as you do at the Department of Children and Families. And so you see the real world impact more up close when you're working for one of these other agencies. And I think more than anything, what I want to be able to impress upon the team and I want to solve for, again, are those real life challenges when you have a loved one who's looking for a service and you've called everyone and they won't take them, or you're having a hard time just navigating how to get a service. Those are real issues and challenges that can make or break someone's day. We had extreme cases where, we're up for hours just calling around. And so, again, I think it's about the coordination and the communication with sister agencies, how we share data. And so my focus is taking that and making sure that we are maintaining open lines of communication with our sister agencies and that we're looking at the tools that we have to make information sharing easier, data more readily available so that they can help their members, their constituents more easily. And then again, just bridging that gap again for some of our state's most vulnerable populations. Also, just making sure we're speaking the same language. sometimes we think we're like saying the same thing, but we're using different words, and it's just like it's going over each other's heads. So I think doing a little bit of translation in terms of this is what it means for them, for us to do it this particular way and to say it this way, it makes a difference for certain groups.
Well, I thank you all for being here. I think we have just a couple of minutes for questions from the audience. So, nope, we do not have time for questions from the audience. All right, so I blew right past the time frame, but I hope you all have been as engaged as I have in having our leadership here and talking about the just touching the surface of the things that they are working on, the impact that it has for the people of our state and for you all as people in the healthcare industry. So please join me in thanking them for their time.